the health series again, and today we have Dr. Anil joining us today, who is the president of UICC. UICC is an organization which is aimed to not only cure cancer, but they're looking and working towards ways and means to avoid people getting cancer. So prevention, cure, we've done a lot of sessions which are oriented towards how do you cure cancer, what are the medications, what are the technologies which are available. But this organization is oriented towards kaise isko band kare, how do you get rid of it. And there are most of the countries are joining hands to do this. So to introduce Dr. Anil, and I would request Shrenik sir, whose initiative is this particular episode. I would request Dr. Shrenik sir to talk about it.
Good evening, everyone. And Dr. Anil sir, a very warm and wonderful welcome. And first of all, I would like to welcome you by joining two hands.
Thank you.
Thank you.
Thank you.
Sir, I would like to mention a very important memory of my life with you. Last year, you were in Ahmedabad for a conference, and I had a grand opportunity, but talking with you for 1 minute, and that too, we were working, and we met. That is what we could connect with at that time, face to face. And the best part is you've been a great, generous support to me for last 2 years without any restriction, without any conditions, and I'm deeply grateful to you for whatever you helped me out and extended support for my relentless pursuit for touching 1 million lives globally. Sir, in your case, as a matter of fact, there is no need of any introduction. Being a UICC president, you are handling and steering the cancer control campaign in 170 countries, and therefore, where I felt a big privilege of having you on our platform. So thank you once again for your valued time, and welcome back to our platform. Thank you. Ravi, over to you now.
Thank you, Shrenik sir, for the lovely introduction, and thank you, Anil, Dr. Anil, for joining us today. You have a vast experience. You have 33 years of experience in neck and head oncology, or cancer. You worked with brands like Apollo and Tata. So how was the journey? And we also want to hear the journey about cancer. What made you to join this organization UICC? Because surgeries itself keep you occupied so much. It's a hectic schedule. You keep traveling. So what made you join this organization जो cancer को completely बंद करना चाहता है, completely against your career, where you're looking for patients who curing patients who are already undergoing this particular thing. So we want to hear the journey, and we want to hear your perspective about the way forward for cancer control, because this is an awesome initiative. We've been doing a lot of events, with help of Shrenik sir, creating awareness about cancer. And all the episodes are oriented towards creating awareness and creating hope, rather than scaring people. ये बहुत harmful है, where people lose hope that cancer आ गया, so this is the end of it. So over to you, sir. We want to, what is the way forward for India?
Thank you, Ravi. Thank you, Shrenik Bhai, for having me on this great initiative on health, on cancer, topics that are very, very dear to my heart. Thank you for your kind words of introduction. Yes, we spent a short time. Like you humbly said that I made an impression on you, you made an impression on me as well. You truly are the Sehen Shah, which is your book, and I just urge everybody who has not read it to read it. 23 years after laryngectomy, uh, to stand as an icon, as a motivating factor for so many of us is truly inspirational. Ravi, as I go on, I just wanted to know, should I speak at a stretch or should I speak in small gaps and then we'll take questions? How should this format go?
Yeah,
Would you like to?
we will go with the questions. Maybe 5 to 10 minutes. You can talk about the area, and
Okay.
then we'll go with the
So,
questions.
so to answer your question as to why I joined the UICC, so for those of you all who don't know, I am a surgeon, a surgical oncologist. I'm trained in all parts of the body, but very earlier in our career and at the hospital I worked, there was a policy decision that we'll specialize in a particular area, one particular cancer. And there's enough literature to show that if you're a specialist in one type of cancer, outcomes are better, you are able to give your patients better care, and you are able to improve results when you treat your patients. And that's why I took head and neck cancer. I was at the Tata Memorial Hospital first as a resident, then as an assistant surgeon, then an associate surgeon, then a professor, and then I rose to become the director of the hospital. While you treat patients, the joy is unparalleled, but you only treat or operate on that one patient on a particular day, two patients on a particular day, three patients on the particular day. But if you go into something else, you're able to touch more lives. And I chose three extra things to my surgery. I chose education because I would go around the country and even overseas and teach people the art of head and neck cancer, which is India's commonest cancer. And I must tell you that I was really, how should I say, people appreciated my contribution. Uh, I was called both nationally and internationally very, very often. And if I can say it very humbly, my 60-page passport would get filled with visas and stamps to and fro within 4 5 years, just to tell you the amount of people that would appreciate what I would teach. So I believe teaching would influence the lives of many, and they would go out and then teach more people. And that's how the quality of education could be better. I took up research and I did some landmark research. Some of my research on oral cancer today stands in global guidelines. They're very pivotal. They're published in journals where I can very humbly again say no one in the country has published before. Uh, in the New England Journal of Medicine, even from the Tatas in 77 years, it's the first time a publication had reached that prestigious journal. And the third important facet, influencing policy. I tried to do it at Tata Hospital, but the administrative structure was such that my policy was only restricted to the hospital. So I decided to join the Union International for Cancer Control. As you said in your introduction, it is the largest NGO globally committed to the cause of cancer control. It has members which are more than 170 countries and 1,200 odd members. Now, 1,200 might seem small to you, but they are not individual members, they're institutions. So, Tata Memorial Hospital is a member. Indian Cancer Society is a member. American Cancer Society is a member. So when we say 1,200 members, it is the entire organization. So if Tata Hospital is a member, we have 3,000 employees. So indirectly, those 3,000 are members of the UICC. The UICC is headquartered in Geneva. The three major areas of its work are advocacy. And to put it simple, advocacy is like no tobacco, no e-cigarettes. Those are the kind of advocacy programs that we do. It has convening. We have some of the best meetings that we hold where we get our leaders from all over the world. to come on one platform. And the third is capacity building, where we have fellowships, we have CEO training programs, so that we can train people towards the cause of cancer control. Briefly to tell you, the mission of the UICC is to unite the cancer community, to reduce the global burden of cancer, to promote greater equity. That means some people have, some people don't have. We are trying to make cancer care affordable to all and to integrate cancer control into the World Health and Developmental Agenda. So, with the aim to influence policy, I joined the UICC. I continue to be an active surgeon. I've joined the Apollo Group as their Director of Oncology. I operate predominantly in Mumbai. As you can see me with my sweater, I'm in Delhi this weekend to help some patients here. I've started coming to the city of Ahmedabad, where Shrenik Bai is as well. And my idea is basically not to do practice, but to influence cancer policy. So even at the Apollo Hospital, we are driving a change. We are trying to get specialty care into our hospitals to help better outcomes, make treatment more affordable, and give people international quality of care. So again, to summarize in one sentence, to do more than just influence the one patient that I would operate in a day or the two patients that would benefit by my skills in the day, I now operate as well as do cancer control policy. And that's the motivation that took me into the UICC. God was kind. I was on the board for 6 years. I then got elected as president elect for 2 years, and now I'm the president. Tough times with COVID because everything is virtual, but it's truly a rewarding experience in my 8 odd years with the Union International for Cancer Control.
Wow, superb journey, sir. Uh, yeah, definitely, worth applauds because, yeah, the overall overview of, getting into something which will benefit everybody, as an NGO, as an organization, I think that's really fruitful. Thanks for getting into that. So, how was the journey so far? And, what's your perspective for cancer control? As Indians, compared to other countries, and you also have other friends from other countries joining in. Where do we lack, and what's the way forward?
So let me tell you that the Globocan, which is a WHO promoted global cancer data, just released new figures on the 14th of December 2020. So it's a free download. Any of y'all can just feed the word Globocan 2020. The cancer incidence globally has risen to 19.3 million, and there are 10 million deaths. This has risen from 12 million in 2012 to 18 million in 2018, and in 2020 it is 19.3 million. So it's increasing. 1 in 5 people develop cancer during their lifetime. 1 in 8 men and 1 in 11 women will die of the disease. At present, there are more than 50 million people living within 5 years of a past cancer diagnosis. So just to tell you that it's a global problem. Now in the West, these are approximate figures for you to understand. We look at cancer incidence per 100,000. How many cancers per 100,000? So in the US and most developed countries, it is about 350 to 400 per 100,000. In India, it's 110 per 100,000. That means we are about 1/3 the incidence in the West. But WHO has predicted that the biggest leap in cancer will come from developing countries, countries with a low developmental index, the incremental increase. Even data published from India The cancer registry program shows a trends in cancer incidence has increased across all sites and in both sexes. And we have the common five leading sites in our country are breast, lung, mouth cancer, cancer of the cervix, that's the uterus, and tongue cancer. Why is it increasing in our country? If you looked at the longevity of our patients, at the time of independence, the average Indian lived till the age of 47. Today, people have started living till 70, and it will increase more as time goes by. If you look at the population pyramid of our country, 50% of our population is less than 30. As they age, you will get more incidence of cancer. To add to it, we have rapid modernization, we have changes in lifestyle, the middle class is growing, and we are taking more and more Western habits. As a result, we will have a higher incidence of cancer. So the problem is big in our country. To add to that, 70% of deaths in our country are in people between the ages of 30 and 69. And these are people who are productive, who can contribute to the growth of the nation. So we must do something with this increasing incidence, and we are losing our patients at the productive years of their life. And a last important factor, in developed countries, if three people are diagnosed of cancer, one dies. That's the mortality to incidence to mortality ratio. In India, out of three people who get cancer, two die. So our ratio is 0.66. In the Western, it is 0.33. तो हमारे देश में डेथ रेट कैंसर की डायग्नोसिस के बाद फॉरेन नेशंस में विदेश से ज्यादा है. The incidence to mortality ratio is 0.66. So we have a high incidence of cancer, a growing incidence of cancer, and we have a high mortality, and we have our patients dying in the productive years of their life. So what should we do? And this generally would be applicable across the globe. There are three things that we can do to outsmart this cancer. One is we should prevent it from occurring. Second, we should detect it early. And third, we should ensure proper treatment and improve the outcomes of our patients. So quickly, I'll give you briefly on what we can do. The first is that cancer should be prevented. Cancer is a lifestyle disease. Two-thirds of cancer occur because of the life that you lead. And in the life, सबसे important बात है हमारी आदतें. जैसे हमारी आदतें उसी तरह हमारे कैंसर हैं. और अपने देश में हम लोग तंबाकू बहुत ईजिली अपनाते हैं. देश में 40% कैंसर, 40% of our cancers are tobacco induced. We chew tobacco, we inhale tobacco in the form of snuff, we smoke tobacco, we apply tobacco to our gums. And that's why out of the 5 commonest cancers, mouth and tongue are very common. I am a head and neck cancer specialist. 30 to 40% of our cancers are tobacco related, or 25% head and neck cancer. तो आप खुद समझिए, if we ban tobacco or we stop the use of tobacco, then probably the incidence of cancer 25% will go down. So that is the first thing that we should do, decrease the use of tobacco. अब बहुत लोग हमसे बोलेंगे कि इतनी खराब आदत है तो गवर्नमेंट ने बैन क्यों नहीं की. बैन करने से it may be one of the methods of doing it. In Bhutan was the first country to ban tobacco. When they did a survey 5-7 years later 25% of Bhutan still consume tobacco after banning. And the first person they arrested, they brought a law that if you are caught with tobacco, you will be arrested and put in jail. The first person they caught was a Buddhist monk. So banning is not the answer. I just read an article day before yesterday in the Times of India, Mumbai, and I'm sure you all must have read it. Bihar has banned alcohol. The title of the alcohol was that banned Bihar consumes more alcohol by the men than in Maharashtra where there is no ban. So I don't think we should ban things. We should explain people as to what is the harmful effects of tobacco. And tobacco is the number one cause of cancer. Even lung cancer globally is the number one cancer. And I think we must stop the use of tobacco in our country by educating people that this is harmful. So it's not banning. We have banned the chewed tobacco, the gutka in our country in 18 states. But if you speak to any of the manufacturers, manufacturing is not stopped. They produce the same amount. So ₹1 की पुड़िया ₹6 की हो गई, कोई और अपने पैसे बना रहा है. We must explain people. And for those of you all who are listening to me, please remember this one thing. You will have children in your house, you will have children in your neighborhood. Some of you all may be teachers, some may be doctors, some may be counselors. Usually people take to these habits of tobacco, alcohol by the age of 20, 25. If they don't take to these habits at that time, they will not take to the habit. So concentrate on your kids, concentrate on college goers. If you can keep them away from this habit, they will be away from this. So I believe the biggest thing in our country is tobacco. 19% of men, 2% of women, that's about 10% of our population smoke. 21% of our population use smokeless tobacco. 42% of our men, 15% of our women, that's about 30% overall consume tobacco in any form. I think it's one of the highest, and I've spent a lot of time on tobacco because I just believe that this is something that we can do to prevent our cancers. There are other habits. Government has done things like we do, we don't. We ban tobacco advertising on the electronic media. We have heavy taxation, but it's only for the cigarettes. The BD and the other things are not so badly taxed. Smoking is banned in public places. So government does do initiatives, but I think there's a lot more done. मैं आपको बहुत simply I will share with you what patients tell me. Patients will come, they'll be 35, 40, they'll come with full-blown mouth cancer. And when I take the history, they will tell me that they consume tobacco, they were applying mashari on their teeth, which is burnt tobacco. And they will tell me कि डॉक्टर साहब हमको मालूम नहीं था कि ये तंबाकू इतनी हानिकारक है. They start applying at the age of 15, 16, 17 as they become, when they should be in the prime of their life, 20 years later, they get a mouth cancer. It's so shameful. If someone didn't know, they say हमको मालूम था ठीक नहीं था, but इतनी हानिकारक होगी हमको मालूम नहीं था. So I think it's a failure of us as doctors. It's a failure of policy makers. It's a failure of government. It's a failure of people like you and me who can use this electronic media to take this news out. So that's the first big thing that we should do in our country is prevent cancers and tobacco. The other factor that causes cancer is diet. Many people in the affluent society don't know that obesity causes 10% of cancers if you're overweight. So please, ladies who are listening, please try to control your weight. Endometrial cancer, breast cancer, kidney cancer, gallbladder cancers when you're overweight. And that's 10% of all cancers. And the third thing that causes cancers, which can be prevented, is infections. HIV, hepatitis, human papilloma virus. हमारे देश में cervical cancer is very common in rural India. पहले अपने शहरों में भी common था, but now breast cancer has become more common. It's caused, the cervix is the mouth of the womb. यूट्रस की मुख जो होती है उसको सर्विक्स बोलते हैं, एंड यू गेट HPV इन्फेक्शन एंड दैट कॉजेज कैंसर। धीरे धीरे वो इन्फेक्शन बढ़ती जाती है, 10 15 20 साल में कैंसर बन जाती है। WHO has given a call this year to eradicate cervical cancer. India has one of the highest incidence of cervical cancers globally. And all we can do is, it's very simple. The WHO Director General on 21st of May gave this call. We at the UICC support this call. And the strategy is very simple. It's called a 90-70-90 approach. 90% of our girls should be vaccinated against HPV. If you do that, over time you'll see a drop in the incidence of cervical cancer. 70% of our women should be screened for cervical cancer, and it can be done with a very simple pap smear. They are better tests like HPV DNA, but for our country, pap smear, and 90% of those diagnosed, if they are treated, we will bring down the incidence of cervical cancer, and we will not have such a high incidence and suffering. So you asked me what are the things that India can do. I will say the first thing is prevent cancer. And if you stop these habits of tobacco, unhealthy diet, you have good physical activity, exercise, and avoid the harmful use of alcohol, four of these modifiable shared risk factors act on four major non-communicable diseases, that is cardiovascular, diabetes, cancer, and chronic respiratory disease, and will prevent 80% of all non-communicable deaths. Four habits, four diseases, and you'll save 80% of your deaths.
Wow.
The second thing that we can do on the way forward is to detect our cancer early. In India, 60 to 80% of our cancers present in very advanced stages. However good a doctor I am, stage 4 की कैंसर की सक्सेस हेड एंड नेक में 50% से ज़्यादा नहीं होगी। स्टेज 1 के कैंसर हो गए 90% होगी। अब आप बताइए, जब मुंह में छोटा सा छाला है, एंड इफ पीपल डोंट कम टू मी, जब 90-95% क्योर रेट है, सिंपल सर्जरी है, कोई प्रॉब्लम नहीं, दे कम इन सच एडवांस स्टेजेस। जब हम टाटा हॉस्पिटल में थे, हमने बहुत सिंपल स्टडी की थी कि लोग क्यों लेट आते हैं। 50% लोग सोशियो इकोनॉमिक रीजंस के लिए लेट आते हैं, गांव में रहते हैं, पैसे नहीं है, जमीन गिरवी रखनी पड़ती है टू कम टू द टाउन। बट 50% ऑफ पीपल कम टू द डॉक्टर, डॉक्टर की जानकारी नहीं है, वो टीबी की दवाई खिला रहा है, कुछ और कर रहा है, बाय द टाइम दे रीच द कैंसर सेंटर दे बिकम स्टेज 4। अगेन आई बिलीव it is a failure of us. We do programs like this and then we forget it, but this message should be continued. So I request you, Ravi, Shrenik bhai, please continue these initiatives. They're great. They will take the message to our people that early detection is very, very important, and they will be able to come in an early stage.
Sure, sir.
Who are who are the people who should be watchful? People who are high risk. आपकी तंबाकू की आदत होगी, you're a high risk. If you drink excess alcohol, you're a high risk. If you're an obese person, you're a high risk. आपके फैमिली में कैंसर होगी हिस्ट्री, तो आप हाई रिस्क में हो. So at least these high risk people should go and regularly get them checked. Plus, if you have sign and symptoms, और sign and symptoms बहुत simple हैं. It goes by an acronym called CAUTION, CAUTION. You can Google it. It's an American Cancer Society acronym. So C stands for change in bladder or bowel habits. If your intestines, you were going once a day to the toilet, now you're going twice a day, 3 times a day, या कब्जियत हो रही है, या bladder in your passing urine, आपकी habits change, go and get screened. In men, it could be prostate cancer. बाउल में कोलोनिक कैंसर होती है, तो वो सी है। ए इज अ सोर दैट डजंट हील। आपके बदन में कोई जख्म होगी जो नहीं हील हो रहा है, then that should be seen by a doctor. So CA. U is unusual bleeding or discharge. Bleeding from anywhere, nose से आए, mouth से आए, बलगम में आए, urine में आए, ladies have intermenstrual bleeding, postcoital bleeding, rectum से आए, stool में, again you have to get treated. So CAU. T is thickening in a lump or breast anywhere in the body. So it could be in the breast or anywhere in the body. Ladies, if they examine their breast, feel a thickening lump, please go and see a doctor. I is indigestion or difficulty in swallowing. खाना अटकता है आपका, or you are eating food, खाना हजम नहीं होता, go get a doctor. Not immediately. Sometimes we can have it because of symptoms. In 4 weeks, you need to go to your doctor. O is for an obvious change in a wart or a growth. We all have some black spots अपने बदन में. वो spot grow होने लगे तो आप सस्पेक्ट करो कि ये मेलानोमा हो रही है या स्किन कैंसर हो रही है, ये जाके आप अपने डॉक्टर को दिखाओ. एंड लास्ट इज N, nagging cough, pain और होर्सनेस ऑफ वॉइस. दैट मीन्स आपकी आवाज में कुछ तब्दीली आई, आप स्मोकर हो, 3-4 हफ्ते तक की आपकी आवाज भारी होने लगी, तो देन यू हैव टू गो टू योर डॉक्टर. सो प्लीज रिमेंबर द एक्रोनिम कॉशन, and that is the right way. So to outsmart this cancer, prevent an early diagnosis, 90 to 95% of your cancers will be cured with minimal treatment. और मैं आप लोगों को एक हकीकत की बात बोलता हूँ, डायबिटीज, ब्लड प्रेशर जब आपको हो, जिंदगी भर आपको ट्रीटमेंट लेनी पड़ेगी. बट कैंसर आपको बाई चांस, आपकी किस्मत ठीक नहीं है, आपको लग गई, आप स्टेज 1 में आओगे, 95% क्योर रेट्स, और एक बार क्योर हो गई आपको कोई गोली लेने की जरूरत नहीं है उसके बाद में. सो प्लीज पीपल, प्रिवेंट कैंसर. Those of us who are destined to get it, if it God wills that we get it, uh, please come in early stage and we'll be able to treat you. So in our country, prevention, tobacco main, early detection, 80% coming in advanced stage, control these two, we'll be set in this country.
Wow. Thank you, sir. And I would like to also take a moment to, thank the sponsors for this particular awareness program, Meditronics. So I'll just play a quick video, a few seconds about their organization and their specialization. Yeah, thank you, Meditronics, for sponsoring this particular event, and also displaying the address to connect with them. They specialize in radiology and nuclear medical devices that helps in cancer detection and screening. So Shrenik sir, that I mean Anil sir इतने detailed description दिए हैं कि I'm left with no questions, because he's covered every aspect of it. Who needs it, what are the areas, and clear statistics on where we need to work on and where we lack. So any questions from you, Shrenik sir?
Sir, actually, I would not like to ask question, but I would like to mention a reason for this specific initiative of our health series. In fact, we are following the same road, same cause, as you just explained in details. Sir, neither me nor we cannot be doctors, and we are not going to be doctors at all in this specific life. But then, since I am connected with oncologists, too many oncologists for more than a decade, I have realized the importance of the early diagnosis, timely treatment, which can help in saving patients' lives, and therefore, I have come forward with this specific initiative of inviting experts like you so that more and more people get awareness. They can get in touch with the experts like you so that at least, as I said, we cannot save lives, but at least we are trying to make an attempt, effort, for bringing people closer to the experts. So, I mean, we are doing our best, and I would personally request. I mean, you are giving too many lectures in India and abroad. Kindly to spread word about our series so that more and more experts can join our platform.
Sure. Without fail, that is without saying my full support for the wonderful work that you do. If I could add to prevention and early detection, a lot of our countrymen, when they are diagnosed, घबरा जाते हैं. They get fear of cancer. देखो, like I tell you, if it is stage 1, you can be treated and can get totally cured. Because I work in a tertiary stroke quaternary cancer care facility all my life, 50% of work I do is redo surgery. मतलब किसी ने ट्रीटमेंट पहले कराई है बाहर, केस बिगड़ गया तब हमारे पास आते हैं. तो मेरी आप लोगों से एक रिक्वेस्ट है, whoever is listening to us, जब आपकी डायग्नोसिस हो, घबराना नहीं. मन में रखो कि डॉक्टर डिक्रूज ने बोला कि if we go to the right person in early stage, we'll be treated well. आप लोग भी थोड़ा सा पूछताछ करके you go to the person who specializes in that cancer. Then you will get the best treatment. That is very important. Second, sometimes people go to places where the treatment is cheaper, but that may be more detrimental rather than beneficial. It is always better to look for the right source of your treatment. Of course, finance is a problem, but it does not mean that you compromise your care. When you go to buy your television, when you go to buy your mobile phone, when you go to buy clothes, when you go to buy gold, you go for the best. Same way in cancer care, and I don't mean best is people who charge the most. I mean people who are specialists in that cancer. That is very important. And that is the message that I would like to give all our people who are listening to us today.
Yeah. Thank you, sir. Thanks a lot for taking time out and coming on to this particular show. And most importantly, I love the way you've joined this particular organization. I love all the members and institutions who've joined UICC on controlling cancer. We would love to spread awareness across. Whenever you have new statistics, new awareness, new programs that are coming up, which should reach the people. So what we are like in mythology, we are the people who actually are the messengers to the end people. So anytime you need help in terms of spreading awareness, do get in touch with us. And yeah, I would like to thank all the oncologists, all the surgeons, all the team behind this particular initiative of treating, preventing, and curing cancer.
Ravi, I want to add something since you said let us know. So I'm going to tell everybody who's listening to us, Shrenik, by you as well. 4th February is World Cancer Day. It's a day that was started by the UICC. There are events all over the world. If all of us in our little spheres can make cancer awareness on that day, it will be wonderful. So let us start planning in our own places. In certain places, they light up monuments, they light up Parliament House. In India, we sometimes light up our sea link on various days, like on Breast Cancer Day, the color pink. So maybe we can do that awareness, it will be wonderful. And the second is May 31st, our World No Tobacco Day, and particularly tobacco is such a big problem. So we can mark these 2 days in our calendar. I'm sure, Shrenik Bhai, you can lead some great program, and why you, everybody who's listening, should lead it in their part of the world.
Sorry. Yes, yes, absolutely. We'd love to. And in fact, I am participating every time in UICC on 4th February for last several years.
Great. So great. Happy to be part of this great show. God bless you all for the wonderful work you all do. Thank you very much. I've got another webinar starting in 10 minutes from now.
Thank you, sir.
It's a pleasure. Thank you, sir. Thank you.
Thank you. Thank you,
Thank you
viewers,
very
for
much, sir.
joining us. And as Sir said, each one of you are brand ambassadors for controlling cancer. So spread the awareness out. That's the humble request. Thank you. Have a great day.